I first suspected they had OCD. I first started seeing signs with Kate in like kindergarten. She would spit on her hands because they felt dry. So I started seeing little signs here and there after that. But it didn't get really bad until where it really interfered horribly with life until this last fall. Kate got worse first, and then Jane a few months later. Because they're identical twins, some people say it's genetic. I mean, with us, it seems like it's genetic. We kind of knew not if she would have it, but when it would kind of explode. Her anxiety was just sky high, worrying about things. She started having suicidal thoughts. By the holidays, it was almost unbearable, so for everybody. And then around Christmas, Jane started really ramping it up as well. It's heartbreaking to hear your kid, number one, say they want to kill themselves at 11 years old. It scares you to death. When I saw it getting bad, immediately took action, which is why I've been so proactive with their treatment. We're from Kansas, and there's not any good programs close. And when you're the fifth or sixth therapist you've been to over the last, over 3 or 4 years says she's so severe I can't treat her. It's a miserable situation to feel no hope. And that's what we were feeling for so long. My parents have an RV, like a apartment on wheels, basically, a nice, has a bedroom, and they said we can take it anywhere. And so I started calling around all over the nation. I saw Bradley, it was in Rhode Island, and I was like, oh, we're not going to Rhode Island. That is so far away. That's just not far away. That's really up there. And I'd called UCLA, I'd called all these different, everywhere. And when I called Bradley, immediately I could tell this was different. I then started doing some research about family-centered therapy, and Bradley kept popping up in these articles. And it was over and over just like, this is where you should go. This is where you should go. So we packed up on March 28th, and my parents and the 4 of us and our golden doodle, Millie, who's a big part of our coping process, packed up and drove to Rhode Island from Kansas, like 1,500, 1,600 miles or something. We got to Bradley the first day, and Jane had her intake first with Dr. Case. And immediately met him, and I was like, oh my goodness, I love you. Like, you are amazing. Just jovial, and Jane immediately felt, comfortable, and because it's very, it's very humbling taking your kids to a psychiatric hospital every day. That's not on your list to do as a parent. And that hit me about the second week we were here. Just it's very humbling to pull your kids into a psychiatric hospital and send them in every day for treatment. And then Kate had her intake with Dr. Funkenstein, and it has been unbelievable. The thing I've been the most impressed about is that among the team that works in the OCD program, there is no hint of any ego between the doctors and the therapist and the psychologist. The sooner you get your kid help, the better it's going to be. And there's no need to be miserable and to watch your kid suffer, because there is help out there. The identical twin thing is unique, and it's been really interesting to see how it plays out. It's going to be great because they have each other when they go home, and they both know how the treatment works. Last weekend, Jane would start to ask a reassurance question, and Kate would say, she said, Mom, could this have this germ on it? And Kate would pipe up and say, maybe, Jane, maybe it could. It could, which is exactly what they've been teaching us to do for them. So it is starting to work for them because they are very close relationship-wise, and I think it's going to be great.